Thank you very much. Good afternoon. Welcome to the Public Health and Minority Health Disparities Subcommittee. We have 5 policies and 8 bills on the agenda today because we have 3 bills where we have both the House and Senate bills in our possession. So we are going to start with Senate Bill 117, House Bill 96. This was newborn screening program implementation of testing. You'll remember that we had a robust discussion on screening for Krabby. And I know that we got some consensus amendments confirmed about 9 o'clock last night. So Erin, if you can talk us through the bill and the amendments.
So the bill, as received from the Senate, repeals the requirement that the Secretary of Health and the State Advisory Council on Hereditary and Congenital Disorders determine whether to approve the inclusion of a core condition in the state's newborn screening program within 1 year after the condition is added to the U.S. Department of Health and Human Services recommended uniform screening panel and implement testing for any condition within 1 year after the approval. The bill also repeals related provisions regarding the disapproval of conditions by the Advisory Council. So instead, MDH must implement testing for a core condition listed in the RUSP within 18 months after the core condition is added to the RUSP. And then the bill has uncodified language requiring MDH to implement testing for infantile Krabbe disease within 1 year after HHS issues its final newborn screening recommendation regarding the disease. There is an amendment that was distributed separately in a second email to you all. And that amendment represents concerns from MDH and also that have been agreed to by Senator Bailey, who's the Senate sponsor. And these amendments ensure that MDH retain the capability to test for conditions that are specific to Maryland, which may or may not be encompassed in the RUSP. And then the amendments also clarify that if procurement issues prevent MDH from implementing testing within the required timeframe, that MDH must notify finance and HGO of the delay and the reasons for the delay, and then every 3 months thereafter until testing for the core condition is implemented. And there's similar provisions for if they are delayed in testing for Krabbe disease.
Thank you, Erin. And I want to say we got Christina from Senator Bailey's office, and we also have Delegate Morgan, who has the cross file on this. Thank you all for all the work you've done. Thank you to the department. I know you've been working diligently. If I can have a motion on the amendments, and then we'll open it up for discussion.
Move the amendments.
Second.
All right, they've been moved and seconded. Delegate Hill.
Thank you, Madam Chair. I just wanted to again thank the committee and leadership and the senator for working on this bill. And as you know, I sit on the State Advisory Council on Hereditary and Congenital Disorders, and I did inquire of Marie Grant and MDH what the role of the council would now be. And I did want to share for the record a letter with this having been discussed at the council's last meeting, which I was not able to attend. If that's okay, I just wanted to share that.
Thank you very much, Delegate Hill.
Okay. It says the council will continue to consider and review conditions for addition to our newborn screenings that are not on the recommended uniform screening panel or RUSP. And the department did suggest an amendment to clarify that point. So that may be something we can add here. Additionally, the council discussed continuing their work on addressing issues around screening, diagnostic testing, and treatment for any newborn screening condition that is added either by the RUSP or by the council. And we'll continue to review updates in screening, diagnosis, and treatment for currently screened conditions. So I just wanted to clarify that since we are legislatively stepping in their role of determining what makes sense for screening here in Maryland and deciding to take the federal as a mandate to us, that there is still a role for the advisory council. Okay, thank you. And I would move if Erin's what she just ran through does not include a clarifying amendment to that point, I would move that we would add an additional amendment
Delegate Hill, it's in there.
Okay, thank you.
Mhm.
And thank you very much, Delegate Hill, for your due diligence in working with the commission as well and representing them in these discussions. Are there any further discussion on the amendments? All right, all in favor, say aye.
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 Anyone opposed, go ahead and raise your hand. So this is on both Senate Bill 117 and House Bill 96. We will be amending them to conform. So on the bills as
Move
amended.
the
can I
bills
have a-
as amended.
Second.
Second.
All right, so on Senate Bill 117, House Bill 96, any further discussion? All in favor, say aye.
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 Anyone opposed, go ahead and raise your hand in the chat. Thank you very much. Both bills pass unanimously. Thank you to everyone for all your work. We're going to move to Senate Bill 245, Maryland Community Health Resources Commission Sunset Extension and Program Evaluation. As a reminder, we've had a lot of these sunset bills, but this bill, in particular, has the Maryland Community Health Resources Commission, which is an independent body within the administration. So, Erin, if you can walk us through the bill, and we have an amendment sponsored by our chair.
This is a departmental bill. It was not cross-filed. It extends the termination date for the Maryland Community Health Resources Commission by 3 years to June 30th, 2028. And subject to the evaluation and reestablishment provisions of the Maryland Program Evaluation Act. There is a reprint that was provided that incorporates an amendment that's being offered by Delegate Payne-Monick. And this amendment would extend the MCHRC by 10 years and instead of 3.
Thank you. Can I have a motion on the amendment, and then we'll open it up for discussion.
Move the amendment.
Second.
All right, it's been moved and seconded. Any questions, concerns, discussions? I see, Mr. Luckner nodding his head. It sounds like we have consensus with the department as well. All right, all in favor of the amendment, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, seeing none, can I have a motion on the bill as amended?
Move the bill.
Second.
All right, it's been moved and seconded. Any further discussion? All in favor, say aye. Anyone opposed, go ahead and raise your hand in the chat. All right, Senate Bill 245 passes unanimously. Thank you very much. We're now going to turn to Senate Bill 578, which is also House Bill 1472. This is Professional and Volunteer Firefighter Innovation Cancer Screening Technologies Program funding. We do have both bills, and we want to move both bills. So if you can, Erin, if you can talk us through the bills, the discussions with the budget, and then we'll open it up for discussion from there.
The bill repeals the current $100,000 annual mandated appropriation for the Professional and Volunteer Firefighter Innovative Cancer Screening Technology Program. And instead, beginning in fiscal 2025, the bill authorizes the governor to include at least $500,000 in the annual budget for the program. There is, in this year's budget, there's $300,000 in general funds that's been added to the budget for the Family Health and Chronic Disease Services within the Prevention and Health Promotion Administration in MDH. And that money is for the purpose of administering the Professional and Volunteer Firefighter Innovative Cancer Screening Technologies Program, contingent on the enactment of Senate Bill 578 or House Bill 1472. The budget provides that funds may not be expended for this added purpose. Funds not expended for this added purpose may not be transferred by budget amendment or otherwise to any other purpose and would revert to the general fund if the bills were not passed.
Thank you, Erin. And there are no amendments on either version. They are identical.
Yeah.
And the funding is contingent on passing the bills, as I understand it. So if I can have a motion on the bills.
Move the bills.
Second.
All right. Any further discussion? Any questions, comments? All right. So this is again on House Bill 1472, Senate Bill 578. All in favor say aye. Anyone opposed, go ahead and raise your hand in the chat. All right, both bills pass unanimously. We are now turning to Senate Bill 594, House Bill 986. This is Maryland Medical Assistance Program coverage for the treatment of obesity required study. As this bill originally came in, it was requiring reimbursement for coverage for treatment of obesity. It has been amended to be a study. And Aaron, if you can walk us through the amendments, and then I think we have a question for Delegate Lewis and the department on the impact of it.
The bill as passed by the Senate requires MDH in consultation with specified stakeholders to study the impact of requiring Medicaid to provide comprehensive coverage for the treatment of obesity, including coverage for intensive behavioral therapy, bariatric surgery, and any medication approved by the U.S. Food and Drug Administration with an indication for chronic weight management in patients with obesity. There is a reprint that's been provided that streamlines the study. In particular, it strikes the requirement that MDH consult with stakeholders in doing the study. And then it also strikes some of the specific language related to the cost savings that may result from requiring the coverage for treatment of obesity.
Thank you. And do we Delegate Lewis is on the phone. Let me turn to the department because I know that we still had a fiscal note of $250,000 from the amended bill when it came over from the Senate. Do we feel that the amendments will reduce the fiscal note? Do we have a sense of what the impact of those of streamlining the study would be?
Yeah, thank you, Chair Bagnall. So with the amendments that Aaron just reviewed, we would be able to conduct that with existing resources. So the fiscal impact is zero with those particular amendments that Aaron reviewed. That
is a glorious thing to hear. If I can get a motion on the amendments.
Move the amendments.
Second.
All right, they moved and seconded. Any further discussion? Any questions, concerns? All right, all in favor say aye. Anyone opposed, go ahead and raise your hand in the chat. All right. That is, again, Senate Bill 594, House Bill 986, both pass unanimously. We have Senate Bill 991. So this is Behavioral Health Language Assistance Services Pilot Program. The bill passed unanimously in the Senate, but there's significant fiscal impact, and I think we have continued discussion. So Aaron, if you can walk us through what the bill does now.
So the bill, like Delegate Bagnall said, passed the Senate. It did not have a cross-file. It establishes the Language Assistance Services Pilot Program to provide meaningful access to behavioral health care to children with limited English proficiency, and establish a competitive grant process for local behavioral health authorities to provide reimbursement to behavioral health providers for language assistance services. By October 1st, 2024, the Behavioral Health Administration must adopt regulations to implement and administer the program. And in fiscal 2025 and 2026, the governor must include $120,000 in the annual budget bill for the program. BHA must award at least 3 grants of $30,000 in fiscal 2025 and 2026 and submit a report to the governor and the General Assembly by December 1st in 2025 through 2027. The fiscal impact is $201,000 in fiscal 25, $190,000 in fiscal 26, and $36,000 in fiscal 27. We did get appropriations approval.
We got appropriations approval. Perfect. Delegate Chisholm.
Thank you, ma'am. So I see it's 201,000. It says contractual positions 1. So I understand, 120,000 in year 1, and then whatever Aaron just mentioned in year 2. How do we get it to 36,000 in year 3? Is this contract position going to be moved out? I don't think somebody's going to take that big of a cut in pay. And if it's one position, and what does that one position do? Do they help just to do the translation in all the different documents?
Murray Grant.
Thanks, Madam Chair. Delegate Chisholm, I think the change in the fiscal note probably reflects the sunset that's on the bill and just like the lag time for implementation. I think that's probably why it reads that way. I think there's also just like a front load to get the work started and set the requirements for the program. I think the way the bill works once things are up and rolling, then it's officially a pilot. So a lot of the work for it is really front loaded.
So when we say one position, one contractual position, it's somebody that possibly already in-house, or are we going to be hiring somebody outside to come in for the next 2 years to kind of get this thing moving forward?
So I think the fiscal note reflects hiring someone from outside. It is an additional position that we need. It's not a current role that currently exists right now.
Okay. All right. Thank you, Madam Chair. Thank you, Maria.
Thank you. I know there was a question about the regulation. Marie, did you want to speak to that, or
Yeah, I'm happy to speak to that, Madam Chair. I think the department, in the interest of moving this program along, would request a slight tweak that we can, even we were just talking with Aaron about, there's a requirement in the bill that on or before October 1, 2024, that we would need to establish regulations to implement the program that have a series of requirements. Our folks think it would be much more expedient to instead establish those requirements through grant agreements. So I think it's really a couple of words that we would just need to change, just saying that the department would establish those requirements rather than on or before October 1, 2024, that we would need to adopt regulations to do all those things.
okay, so maybe not as prescriptive? Is
Right.
that- Okay.
Or it really is like I think we're not trying to like get all those requirements out of the bill. We really just would rather do those things through grant agreements and requirements than regulation, because the regulatory process takes a little bit of time. I think based
Understood.
on
All right,
our
thank you.
calendars, for example, like we would already be behind to try to finalize regulations by October 1, 2024, based on our internal and external timelines.
Oh, okay. Understood. Ms. Woodlard, I saw your hand go up and then it went back down. Did we answer your question?
Yes, I was just going to say, just so speaking for the Public Justice Center, that we would agree with the department in making that amendment to not require regulations, especially if that would make this process more expedient, and as long as the requirements that are in the bill for the implementation of the program and what's required of providers for when they're seeking reimbursement are still met.
And perfect. Thank you so much. Aaron, do we have that conceptually? We're good if we wanted to adopt that amendment conceptually. We can have it by the time we have to vote.
Yeah, I think so. I mean, I think it would just be a matter of striking the regulation reference and the timeline for regulation, and you would just keep the requirements for the grantees in the bill.
All right. And there are no other amendments. So can I have a motion on the amendment in concept?
Move the conceptual amendment.
Second.
All right. Are there any further concerns? Any further debate? All right. All in favor of the amendment, say aye.
Aye.
Anyone opposed? Go ahead and raise your hand. On the bill as amended.
Move the bill. Second.
All right. It's been moved and seconded. Delegate Chisholm, I saw your hand go up. Did you have a further question? You're on mute.
I'm sorry, I thought you were taking the vote.
Oh, no problem. All right, thank you. So this is on the bill as amended. All in favor, say aye. Anyone opposed, go ahead and raise your hand in the chat. I have Delegate Chisholm. All right. So that bill passes not unanimously, and that concludes our work for today. Thank you all so much for being timely, for all the work that you do. stay tuned. We may still have a couple more bills after the bill hearing today. But we'll try and make sure that we're giving you some time. So take back the time that you have, because we know it's going to be an intense week. And with that, can I have a motion to adjourn?
Motion to adjourn.
Second.
All right.